Hello there. It is now day 10 after my surgery, and I just wanted to give you a little update on where things are as far as my daily life as well as my rehabilitation, give you an idea of what to expect around the 10th day after surgery for rotator cuff repair and labrum repair. We typically look at the rehabilitation and recovery from these surgeries as a three-stage process where the first stage is sort of an acute phase. That acute phase is where the tissues are healing. There's a lot of inflammation from the trauma of the surgery itself. The work that they do on the bone, the work that they do on the soft tissue, creates a lot of inflammatory response. And so you have this acute phase where your pain level is fairly high and your protecting of the extremity is of utmost importance. And then that lasts somewhere around 4 to 6 weeks or so. And then we go into more of a rehabilitative phase where we are now working to get range of motion back in the extremity, and the tissues are now starting to do more in terms of healing and structural reintegration, where you have the tendons that have been sewn back to the bone are starting to interdigitate back into the bone. Where they've sewn the labrum back down to the bone, you're getting some scar tissue buildup and some things to try to adhere those tissues to the bone. And at that time, you're still protecting the extremity, but you're not necessarily in the sling all the time, and you're a little more free to push into a little bit more range of motion. Still not doing a lot of strengthening, but you're starting to get more functional use of the arm back. And then we go into the third phase, which is more of a remodeling phase and more of an aggressive rehabilitation phase, where the body is now trying to hone down those tissue interfaces, trying to remodel everything, and rehabilitation involves doing more strengthening, doing more functional activities, getting back into full use of the arm. And that's usually extending into the 12 to 16 week mark. And so right now I'm still in a fairly acute phase. I've got improving pain. On the positive side of things, I'm able to put on a regular shirt now. I'm able to shower, and I'm able to come out of the sling periodically to do the pendulum exercises and to stretch the bicep and to work on posture, things such as that. I'm able to eat regular food without having much gastrointestinal upset, and I'm not taking pain medication anymore, and basically am feeling quite a bit better. I'm not in that acute post-surgical pain now. The pain has taken on sort of a different characteristic. On the negative side of things, I am still having some pain in the shoulder. The pain is different. I have really 3 types of pain which are signaling me that healing is occurring, and so I try to embrace the pain as a sign that the proper healing is happening. But one of the pains I get is a very sharp sort of localized pain around the incisions, where I get what we call zingers or nerve paresthesias, where I can feel a little bit of nerve regeneration right around those incision areas. I also get kind of a deeper, sharp, kind of a bone pain in the shoulder. It almost feels like a catch, or sometimes it feels like I've got the shoulder a little bit out of position. It feels like it may be a little bit out of its normal alignment. It feels a little locked up, and I get kind of a sharp catching pain. And then I also have sort of this just generalized, deep, annoying, sort of aching pain that's like an itch that you can't scratch. And that's the sensation that makes it difficult to sleep at night. Another negative as far as what's happening right now is that I still am having difficulty getting comfortable at night. It is tough to get comfortable at nighttime, and so sleep is sporadic, and I'm still sleeping upright in a recliner, having to change positions frequently. And then another negative too is that the sling, after a while of being in it almost 24 hours a day, you start to develop areas of pressure, especially on the inside of the elbow, up here in the neck area, where the pillow rests on the side. That annoying pressure starts to get to you, especially when you're trying to sleep at night. And then maybe the only other negative is that I noticed that the adhesives of the waterproof bandaging that I'm using to cover the incision sites really is irritating the skin. So I've got a lot of skin rash around the incision sites because of the irritation of that adhesive. And so I've had to stop using waterproof bandaging. I'm just using regular Band-Aids now, and I'm cleansing the area with HibaCleanse in the shower, and then I'm using betadine swabs, and then just putting a regular Band-Aid, and that seems to be working out good. And I should be able to get those sutures out here in about 5 days or so. And so that's kind of where we are in the process right now. As far as nutritional aspects of what's going on, I am still trying to eat as healthy a diet as possible so that I can give my body the nutrients that it needs to heal. So I'm still doing fruit smoothies, trying to get as much fresh fruit and vegetables into the system as possible. I also started juicing a little bit, trying to juice things like carrots and beets and other things that have a lot of nutritional benefit for the healing process. I also started taking some supplements that are known to be good for joint health, including hyaluronic acid and the chondroitin glucosamine sulfate type supplements. I'm not a dietitian or a nutritionist, but I do know that there are certain things that are supposed to be good for the healing process. I've been taking some of that type of stuff. I was still taking a probiotic, which is helpful for the GI upset that occurs when you take a lot of medicines and go under anesthesia and all that kind of stuff. And then in addition to that, just taking a really good multivitamin, trying to stay well hydrated, and trying to avoid things that promote inflammation, like a lot of carbohydrates, caffeine, alcohol, and all those kinds of things. So that's where we are at this phase. The only other issue that I've been noticing at this point in the game is I still get a lot of swelling build up in the fingers, the hand. I think it's because the hand is always in a dependent position. It's always kind of hanging down. It's also a little constricted up here, so the normal lymphatic flow is disrupted. So I get swelling in the fingers and the hand, and I've still got some swelling in the shoulder and the armpit area. So being a lymphatic physical therapist that works with patients who have lymphedema and other swelling disorders, I'm actually utilizing some self-lymphedema and swelling management techniques that I will show you here in a little bit that kind of help relieve some of that swelling. But it's difficult to make a fist still, and my knuckles feel very tight because there's a lot of swelling, and it's just a little bit painful from having that edema sort of stagnating in the hand area. So we'll talk a little bit about ways to manage the swelling in the extremity, and we'll also go into some other techniques to help with some of the positional issues I'm having, where I feel like the shoulder's a little bit out of position or feels like it's catching. All right, so we'll get to that here in just a second.